I would like to talk with you today about living with long COVID, and from a perspective of someone who is a trained mental health professional, as well as a PTSD expert and a COVID long hauler. I'm battling something that is really incomprehensible as a patient who has been living on this sinister journey for 28 months. Medical professionals have been faced with an incredibly complicated clinical picture, one that is highly variable, caused by a novel virus that behaves unlike any known previously. I refer to the myriad symptoms as being on the corona coaster. I think it's important that we acknowledge that many patients have been gaslighted by their physicians because they were unfamiliar with what was going on because of the novelty of this virus. Many of my fellow long haulers have been told that their test results found nothing of significance, so their physicians stopped looking any further. They made a functional diagnosis as the person is suffering with anxiety. Unfortunately, that leaves people who are very sick feeling dismissed and hopeless. And sadly, I must actually acknowledge that despite having the word in my title, I was gaslighted in Florida by doctors who said in the summer of 2020 that they failed to see a unifying diagnosis. After 5 hospitalizations in 6 months and rapidly deteriorating health, I left and went to New York to this Center for Post-COVID Care at Mt Sinai. I was there for 11 months. Fortunately, I had the resources to relocate and seek care. What I hadn't expected, and I really had to come to terms with, was that I would not receive actual treatment. There was no treatment. There was only symptom management. In retrospect, however, I feel very fortunate to have been a part of so many studies. No part of my body was left unexamined. I received considerable encouragement and support from my huge team, and they acknowledged that their patients were being gaslighted, and it was their goal to validate us and create an individualized care plan. The physicians all said, we're learning from you as we go. We're here to help you in all the different disciplines that you need. And in many instances, as you see this list of specialists that I had, I would have 2 or 3 subspecialists within that particular area. Prior to contracting COVID-19 for the first time, I was a very fit and active person until I awakened 2 hours and 20 minutes late for work, and I was very ill. Here are the classic symptoms. Almost 3 years into this pandemic, physicians around the world are starting to acknowledge that traditional tests don't reflect the severity or length of illness that long COVID patients are experiencing. I learned that firsthand when I got to participate in a study using a 7 Tesla MRI PET. 1 year after my initial illness, almost to the day, I still had visible ground glass opacities, bilateral apical and basilar lesions in my lungs, and pleural effusion, none of which were appreciated by my initial physician, who said I simply had asthma and was unwilling to allow me to have a CT of my chest. I still struggle with hypoxia. In the picture you see here, these were actually just taken this past January and February when I was in the hospital. And I think it's really important to understand that I was 18 months post-acute COVID, and I was still suffer with respiratory impact. The studies that I participated are in this very fancy machine you see here. This is where it was realized that I had injury to my brain, my bones, my heart, my lungs, my right kidney, my liver, and my gastrointestinal system. The other 3 photos are from my hospitalization in January of 2022, where I spent 40 nights in the hospital because I developed Guillain-Barré syndrome. Had I not been able to be at Mount Sinai, I would never have evidence of the realities of what I was experiencing. This next slide is a really important slide because I went ahead too fast. It's the policy of Mount Sinai's research team that if you have any abnormal results, they'll communicate that to your consultation team, and the results will become part of your medical record. So I'm very fortunate to have that. Everyone collaborated with me to make decisions about medications to try. Another ongoing issue that I battle is cardiovascular symptoms, which were mentioned just before me. Here's some photos of my journey. I've been hospitalized 16 times over the last 2 years, 4 months. And I was hospitalized. This was my 3rd hospitalization when I was admitted on August 4, 2020, 3 months into my COVID illness. And I had suddenly developed atrial fibrillation. And it took 10 hours before I was converted to a normal sinus rhythm. I was chemically converted. I continue to have paroxysmal atrial fibrillation. And the slides with the 47 and the 194 are recent slides. And the highest my heart rate has been is 224, and my lowest has been 37 when I was just hospitalized this past winter. These slides talk about some of the autonomic nervous system symptoms that continue to persist to this day. I was diagnosed with Guillain-Barré syndrome, and I had all the very typical symptoms of that. And I'm still experiencing a number of symptoms. I am no longer in a wheelchair 100% of the time. I can stand up for a brief time, and I can walk for 6 minutes using a cane. And so I've made some tremendous progress. I can use my hands. I can't hold things very well, but I'm making progress. I still have hypoxia, and my weight fluctuates. My lowest was 96.8 in terms of my weight. Right there, it was 97.7 when I was in the hospital in February. And my body temperature fluctuates as high as 105 down to 96. So I have a tremendous fluctuation in my autonomic nervous system arousal. I struggle with postural orthostatic tachycardia syndrome and orthostatic hypotension, and you can see my blood pressures there. These were, again, very low and very high, all in the same day. It's important to mention that we've yet to confirm the cause of long COVID. It's notable that a Harvard study was discussed in the Wall Street Journal on September 8th, and there's a growing number of researchers who believe in viral reservoirs. The study reveals that a spike protein of the virus was found in the blood of long haulers up to a year after the infection, and that was the length of the study, but not people who had recovered. I am one of those people. The data suggests that viral reservoirs may be provoking the immune system in some patients, causing blood clots and inflammation. More research definitely needs to be done. There are some people who have found fragments of the blood in long haulers like myself. In this slide, you see that I am experiencing a rash. I've had many, many rashes. And in the picture of my foot, that was just in May when I developed another blood clot in my body. This was a popliteal blood clot and behind my left knee. So I've been on Eliquis since the beginning of when I was hospitalized, and nevertheless, I am breaking through that medication with blood clots. And my D-dimers were normal. So very interestingly. So the next sort of area of my symptoms is this constant state of allergic reaction, muscle spasms, stabbing pains, GI symptoms that are crazy, and then the blurry vision and very uncomfortable eyes. And this slide is 55 symptoms of long COVID. I have all but 9 of those symptoms and others that aren't on here. And I wanted to draw your attention to a slide of a study that's in the references by Hannah Davis. She's a COVID long hauler, and she identified 203 symptoms that we have been experiencing. And like the speaker before us mentioned, there are a lot of symptoms that aren't being asked about because people didn't know we needed to ask about them. The psychological consequences are really quite significant. And so I wanted to—
1 minute, Robbie, Dr. Robbie, 1 minute, we're almost at the end here.
Thank you. We're almost at the end. I have experienced the 3 in red: anxiety, PTSD nightmares, where I'm screaming out loud. My entire family hears me screaming, "Help me." And I had a hallucination that involved a goose and a duck visiting me in my bedroom. So I wanted to share where this comes from. I have a beautiful backyard where I have lots of geese that visit and lots of ducks. And in the top corner, you see this beautiful family of ducks born this summer. And I want to know this: why did anyone think this very scary bird, who would certainly cause me nightmares, should be who delivers our babies? So takeaway: long COVID can damage any organ at any time. Long COVID is not brain fog, it's cognitive impairment, and COVID damages our immune system. Resources: Survivor Corps, fantastic organization, very large all over the world. They have great resources for survivors as well as physicians. Masking Together America is another fabulous resource. We have to do something to mitigate long COVID. Masking is, in addition to vaccines, will be helpful. And the last slide is my references. Thank you very much for your time.